If you or your children have ever suffered from tonsillitis, you know how painful and debilitating it can be, and you're not alone. A lot of people are afraid of tonsillectomies because they require weeks of recovery time, and you drastically have to limit your diet. But now a new laser procedure is making your grandfather's tonsillectomy a thing of the past.
I first started having problems with tonsillitis when I was young. I would get frequent infections, sometimes 3 and 4 times a year. It was really painful. After 25 years of having problems with my throat, my tonsils officially have their notice of eviction. Feeling very nervous today. I really don't know what to expect as far as pain goes.
So today we're going to do the laser tonsillectomy. We're going to treat those tonsil stones. It's a little topical pontocaine. It's a numbing agent. You can see moderately enlarged tonsils on both sides. I'm looking at the left tonsil here, and there's actually a little stone, a little white spot right there. And what we're going to do is we're just going to resurface that tonsil so that it's smaller and smoother. You want to be able to see that the tonsil over here is probably half the size that it was. So the tonsil's been reduced in size by about 50%, and that rough surface has been resurfaced, so it's smooth. We're all done.
We are?
We're all done.
Oh my gosh.
Yeah, you did great.
Jamie is here along with Dr. Craig Schwimmer. He's the medical director from the Snoring Center in Dallas, Texas. Welcome to both of you.
Thank you.
Welcome back.
Well, thanks. Good to see you both.
So it's funny because we all talk about tonsils and tonsillectomies, but most people don't even know what in the world the tonsils do.
Right. And tonsils are the little lumps of tissue in the back of the throat on either side of the tongue, and they're actually part of the immune system. They're like little antibody factories. And so when people have frequent infections, those factories enlarge. They increase production, and they swell and they get bigger. And one of the problems can be that when those tonsils are chronically infected, they get a really rough surface that can accumulate food particles and skin, and that can accumulate in those crypts, as we call them, and be very problematic for patients.
Especially for adults.
Exactly.
Because as we get bigger, the tonsils are bigger.
Exactly.
You may not have had them removed as a child, but as adults, they can collect all that stuff and bad breath and infections.
So they can cause irritation, bad breath, and they're really troublesome to patients. And the problem has always been, as you know, a traditional tonsillectomy is a horrible thing to endure. So it solves the problem, but sometimes the cure is worse than the disease.
Well, Drew was just talking because Drew trained as an ear, nose, and throat doctor.
And first,
you were talking about how difficult they used to be.
For doing a tonsillectomy on adults, I mean, it was a big deal, and we talked about that a little bit. And it was a great way to lose weight because you couldn't eat for a couple weeks after surgery, and you had to get them on really strong.
And you're calling that a great way to lose weight?
Well, I was being facetious.
Right.
I mean, if you want to lose weight, doing a tonsillectomy in an adult will do it.
Yeah, that'll do it. My standard pre-op instructions for an adult tonsillectomy patient were, you'll come in, you'll go home, you'll spend the next 2 weeks at home on the couch thinking of ways to hurt me back.
And Jamie clearly doesn't need to lose any weight, but walk us through what happens in a tonsillectomy.
So in a traditional tonsillectomy, what we do is we take the patient to the operating room, put them to sleep, and then actually grab the tonsil and pull it towards the middle, and then take an electrocautery device and sort of cut and burn it out from its capsule. And the reason that it hurts so much is that what we're cutting it out of is muscle. And so we cut into that muscle, so after the operation, the patient has a raw muscular surface in the back of the throat that they've got to swallow through while it heals. And it's just a terribly painful 2-week recovery.
You know what a bad sore throat is like. This is a real bad sore throat.
Yeah, it's terrible.
And that's where lasers come in, I take it?
Absolutely. What we did was a subtotal laser tonsillotomy, so we did not remove her tonsils. All we did was use a very sophisticated carbon dioxide laser in the office to reduce the surface of the tonsil. We kind of vaporized the outer surface sequentially, so we made them an awful lot smaller, about 50% smaller, and smoothed the surface. So we solved the problem.
Those crypts
exactly.
that were the source of infection, particles, bad breath.
Exactly, because it's that outer mantle that's chronically infected. So if you remove that, you solve the problem without getting into the muscle and getting into the pain.
Sort of like a skin resurfacing, which we do with CO2.
That's exactly right.
Okay.
Same principle.
And Jamie, can I ask a favor? Would you mind if we all look at your tonsils?
You really want to see those tonsils?
Be my guest.
Actually, if you want to, let's take a quick look at her tonsils now. And while you're doing that, explain to us who might be a good candidate for this procedure.
So this is a procedure for adults. We don't do this on kids because we do this in the office with the patient awake. And Jamie spent a total of, what, 20, 25 minutes in the office, something like that.
And Jamie, you're feeling better now?
I feel a lot better. Yeah.
Great.
And so we'll take a look, and her tonsils now, and open for me, Jamie, please. I'm just going to touch this against the side wall here. Her tonsils are now about 50% the size that they were. And remember, she's only 6 days out, so she's still swollen. And her tonsils.
And what you're looking at in the middle there is the uvula,
yeah.
And then on either side, those two big lumps of tissue that Dr. Schwimmer is pointing to right now. That's the tonsil on one side, and that's the tonsil on the other side.
Exactly.
In the back of her mouth.
And it's a little white as a reaction to the laser treatment.
Exactly. That's the normal healing process. And these will reduce in size by another 10 or 15%. They're currently about 50% of the size that we started with.
Fantastic. Exciting new technology, and Jamie, we're glad you're feeling better. Thanks for being with us.
Thank
Dr. thank you for being with us. We appreciate it. Coming up, before you head to the mall to get some new summer clothes, did you know there's a piece of clothing that can protect your health and help you look younger? We'll tell you what it is after the break.